Hi, my name is Disa. Welcome back to my series. Today we're going to be talking about PDA, or patent ductus arteriosus. What is patent ductus arteriosus? Firstly, we need to discuss the differences between a fetal heart and a postnatal heart. A key difference is the fact that the lungs are not functioning in a fetus. After birth, our lungs, of course, are responsible for getting rid of CO2 in our blood and reoxygenating it. But in a fetus, they don't have this ability. Instead, there are two bypass systems, if you want to call them that, in the fetal heart that allows blood to bypass the non-functioning lungs. One is called the foramen ovale, which is a small hole in the septum of the heart, and this allows blood to bypass between the right atrium and the left atrium to get pumped back into circulation. There's also a vessel in the fetal heart called the ductus arteriosus. This acts as a safeguard and redirects any blood that might be going up the pulmonary artery to the non-functioning lungs to actually be redirected into the aorta. Almost immediately after birth, the ductus arteriosus closes by what is called a vasoconstriction, or constriction of the vessel, and eventually it forms a ligament. Unfortunately, this process does not always happen the way it should, and the vessel might remain postnatally. When this occurs, oxygenated blood that is flowing into the aorta passes back into the pulmonary artery because the blood pressure is higher in the aorta and things flow from higher pressure to lower pressure. So this means that the already oxygenated blood is going back to your lungs instead of being pumped to the rest of your body, and therefore your heart must work harder to meet the necessary demands. What are the symptoms of PDA? A small PDA defect might not show any obvious symptoms at all, but as it increases in size, more blood will be passed obviously through it, so then that might cause some more obvious signs. Some of the symptoms include difficulty breathing, loud heart murmur, abnormal pulses, exercise intolerance, and puppies with PDA may seem more sleepy and they might have stunted growth. What happens if you do not treat PDA? If blood continues to flow through the PDA, it may cause irreversible changes in the heart muscle that could lead to congestive heart failure. If the PDA is significant, additionally, some symptoms might include a heart arrhythmia, increased lung sounds, and accumulation of fluid in the lungs and abdomen. If the vessel is quite large, the pressure in the pulmonary circulation may continue to increase until it exceeds the pressure in the aorta, which can cause detrimental effects. What this means is that instead of the deoxygenated blood going to the lungs to be oxygenated, it actually bypasses the lungs and enters the aorta. This is called reverse PDA. Some of the initial symptoms might disappear at this point, but other symptoms like cyanosis of the hind leg foot pads, collapse of the hind legs, and weaknesses might be present. There is no surgical treatment, unfortunately, for reverse PDA. How do we diagnose PDA? We diagnose it through a presence of a continuous heart murmur. We will do chest x-rays and an ECG. We'll do blood tests. We would do echocardiography or cardiac ultrasound. This is important for diagnosis. I actually scrubbed in for the first time to a PDA last week. When I scrubbed in, this was considered a pretty critical case because anything can happen to the patient and sometimes there's nothing that we can do about it. A lateral approach was performed to the left hemithorax through the fourth intercostal space. We must be careful not to cut the vagus nerve. We must isolate the patent ductus arteriosus. So we use right angle forceps to dissect the surrounding tissue on the caudal and the cranial aspect. The right angle forceps are then placed underneath the ductus, and we use other forceps so it was my job to hold the other forceps that had silk suture taut, and then I pass it through to the right angle forceps that are underneath the ductus, and I pass the silk suture in between the forceps. We gently pull the silk suture then around the ductus. The ductus is temporarily occluded. Then the suture is tied off if the result is favorable. We lavage the area with warm saline, and then we place a thoracic catheter before we close. Post-surgery, we listen to see if the murmur is still there. A repeat echocardiogram is recommended about 4 weeks post-op just to reevaluate the heart and to see if we need any more heart medications for further treatment. So that is this week's talk on patent ductus arteriosus. Next week I will be talking about foreign bodies.